Junction Youth Health Service, this is Taylor.
Hi, I'd just like to make an appointment, please.
Yeah, have you been to the Junction before?
No, this will be my first time.
Great, so we usually book you in for a longer appointment as a new patient. So to make sure we book you with the right person, do you mind me asking what reason you need to attend the Junction?
So it'll be for a sexual health checkup, please.
Perfect, so a sexual health checkup can be done with one of our nurses here at the Junction. So let's find a time to suit. Yep, so just please bring your Medicare card and we'll ask you to fill out a registration form when you get here. And we'll see you on the day. Thank you.
Okay, so we just got to the Junction. Let's go in. Hello.
Hi, I had an appointment today.
Yeah, of course. I'll just get you to fill out this patient registration form. Just read it back when you're done.
Sean? Hi, come on through. Thanks. Just in room 1 today. Have a seat next to the desk for me. Okay. And welcome to the Junction. My name's Julie. I'm one of the nurse practitioners that's on today. And you've not been to the Junction before?
No, first time.
Excellent. Okay. So because it is your first time, there's usually a couple of questions that we need to ask you and get your, whole file filled out. But to kind of start us off, what brings you in to see us today?
So I just wanted to have a bit of a sexual health checkup.
Absolutely. Look, we do recommend all young people get a sexual health checkup on a regular basis. And the reason for that is because sometimes we can have an STI without even knowing that we've got one. And so we'll start off with just, is there any past medical history that we should be aware of?
No.
Okay, and is there any kind of allergies to any medications at all?
No allergies.
And are you on any medications at the moment?
No.
Excellent. Okay, you've got a nice, easy history to fill out, which is really good. So then, of course, we do need to ask a little bit about your sexual health history, and that's so that we can determine the right test to do to ensure that you do get that sexual health checkup. Okay. Have you had a sexual health test before?
No, it'll be my first one.
Excellent. Okay. So then we'll explain a little bit more about what we do as we go along.
Okay.
But in order to make sure that we do order those right tests, when was the last time you had sex?
Sort of been about 2 weeks ago.
Okay, and that's good. The reason why we ask that question is because there is a timeline of when we can do the tests. We usually need at least 7 days. Do you mind me asking if that partner was a regular partner or a new casual partner?
So it was a new casual kind of thing.
And that's probably the reason why you've come in today is just, kind of want to make sure. What we know is with things like chlamydia, 80% of women don't get any symptoms and about 50% of guys don't get symptoms. So not everyone knows they have as an STI before they come in. And I guess on that note is if you've not had other tests before, this will be the first one that you do.
Yeah.
Other than that, what type of sex were you having? And the way we usually ask that is, did you have oral, vaginal or anal sex?
Sort of been oral and vaginal.
Yep, okay. And did you have any symptoms at all that caused you to come in today?
No symptoms.
Okay, well, no.
Yeah.
And it is always good that we ask that question. So some of the symptoms that we're looking for is for if people have had a change to their vaginal discharge, if they've had a change to their periods, if they've had any kind of painful or stinging when they urinate, and you've not had any of those today. No, excellent. Okay, and your past partner, was that male, female or both?
Both.
Okay, excellent. So what we can do today is get you ready to do just some of the sexual health check. I'll go through what some of those tests look like as well. So today I think if we're going to do one of the basic STI screens, we'd be looking at doing a test for chlamydia and gonorrhea. And we can always discuss whether we think there's a risk that we would need to do bloodborne viruses. To test for bloodborne viruses, we would need to do a blood test. Okay. But today, why don't we grab one of these things over here? And so whenever you do an STI screen, what we often say is that you can self-collect the samples so that it's nice and easy to do. It shouldn't be complicated. You can go to the bathroom by yourself, collect the samples, and we can kind of go from there. We can get a first pass urine. A first pass urine can be done at any time of the day, but it's the first bit of urine that comes out when you go to the toilet. And we're trying to capture any of that bacteria that might be from an STI.
Okay.
The other thing we might get you to do is a vaginal swab if you're not on your period. It looks like an ear cleaner, an earbud that you would use to clean your ear. Unfortunately, it's not going to go in your ear. What you'll do is go into the bathroom, insert the little cotton bud like a tampon into the vagina for about 10 seconds, turn it around a couple of times, count to 10, then you put it into the container, bring it back to me and we can send it off to the lab for testing. Okay, do you feel comfortable to do that in the bathroom today?
Yeah, too easy.
Excellent. I'll pop them into a bag for you and we'll get you to go do that. Hi Sean, come back through and have a seat. How'd you go?
Yeah, just in there.
Excellent, not a problem. So what I'm going to do now is pop some labels on those. We'll get a form and we'll send them off to the lab. Now I did notice that I don't have a copy of your Medicare card. We do want to send these off with the Medicare card attached, so the test today will go under Medicare. Is there any concerns with that today?
So if I put in the Medicare card, what's the surrounding confidentiality?
Yeah, look, a lot of people are quite concerned about that. What we do know is that over the age of 14 in Australia, any time you see a doctor, including coming here to the Junction, or you get a test done and it goes under your Medicare card, no one, your parents, your partner, your friends, can access those test results or even the fact that you've had the test done without your written permission.
Okay.
Okay.